two main reasons why we miss long-term outcomes. Firstly, most of the randomized trials that are designed to compare the efficacy and safety of these devices are designed for short-term outcomes. So they look at 12-month and 24-month outcomes in devices that would be used in patients that we'd expect to have 5, 10 and 15-year life expectancy. So that's the first thing. And then the second thing is that a lot of the important outcomes that we're interested in, such as dying or having a stroke, are relatively rare. So even though you may have 600, 700 patients in a trial, the chances that you'll see a meaningful difference in the important outcomes within the trial timeframe are relatively limited. That would be absolutely ideal, and it would give us very important and meaningful information. Having said that, one of the limitations to randomized trials is just their prohibitive cost. So that is one of the drivers for the shorter endpoints. Most of these trials are designed to continue collecting data into the long term, but the challenge is that the decisions for approval and the decisions that practitioners use to inform their clinical practice are really based on very short-term outcomes, and benefits of standard of care like surgery often only materialize after 3 or 4 years. It's very clear when you look at the history of cardiac surgery and cardiology that a close collaboration between academic leaders and industry has been a real driver of performance improvement and change and progress, and could not have accomplished without it. The cost of trials is prohibitive. The National Institute of Health has funded 25% fewer trials over the last 6 years, and industry has stepped in to build the breach. But that does mean that 2/3 now of trials in our space are industry sponsored, and that clearly has had an impact on both the design and the way that these trials were reported. And I think there is a real need for more independent investigator-initiated research. The role of the key medical journals is absolutely key here. They really are the gatekeepers to the dissemination of this research and the impact that it has. And they take that role extremely seriously. There is a strong suggestion that we, certainly as a specialty, because this is so prevalent in our specialty, consider that industry-sponsored trials should not inform guidelines. But having said that, the lack of funding for trials would mean that we would have very few guidelines based on trials if that were the case.